I'm going to be honest. I was never a big fan of EKGs and learning about them. But I tell you one thing, when you understand what the process is, what's going on, it can make life a lot easier for you when you're answering those questions. So here's a cardiology question. When assessing an ECG, the nurse knows that the PR interval represents the time it takes for the blank. And so we're looking at basically this question just wants to see if you know what the PR interval is. So that is the key thing. We're looking at the relationship between the PR interval on an EKG and what it means. What is the interpretation of that? Is it an impulse to begin atrial contraction, impulse to transverse the atria to the AV node, or C, the SA node to discharge the impulse to begin atrial depolarization, or the impulse to travel to the ventricles? So you have to think back to what are those waves? The P wave, what does it mean? The QRS and the T wave. And so when you start narrowing it down, what do you think the answer is? Go ahead and pause this video and write down your answer, and then write down your rationale. When you're done, come back to the video. So we have to look at, go ahead and do that. And then I'm going to go ahead and resume. So when we look at A, impulse to begin the atrial contraction, right? We know that atrial contraction is the beginning, right? The impulse that starts in the right atrial. And the SA node, that is correct. And so if you said that. And so basically that is going to be your P wave. But we're not looking at the P wave. We're looking at the PR interval. Impulse to transverse the atria to the AV node. Well, I think it's a little bit further than that. PR, the SA node to discharge the impulse to begin atrial depolarization, which is the opposite of A, right? And I know sometimes you've been taught that if something says the opposite, it's going to be either one of those, and that's not necessarily true. D, impulse to travel to the ventricles. So we're having the P wave is involved, which is atrial contraction. And we also have within that PQRS, we have atrial depolarization, but we also have ventricles. The electrical current is going to the ventricles. And if I can show you, hopefully we won't run out of time here, but if I can actually show you, one of the things that I do for students is that I encourage you to look at or even draw what the PR interval looks like. And here's my picture here, right here. So when we look at this, the P wave, atrial depolarization, QRS, see how the R is there with ventricles? So at this point, it's going past the atria to the ventricles, right? And so our answer for that question, then we have the T wave, which is ventricle relaxation. Re means relaxation. So when we go there, we know that that our answer actually is going to be D, because we're talking about the polarization of or talking about the impulse going to the ventricles. So here is it. Here is your rationale. So when we look at the SA node, look at the AV node, and we know those waves, P, Q, R, S, T. All right, you guys, I'll talk to you soon. I've been talking about the NCLEX mindset and how it's important for you to believe in yourself, believe that you are capable of passing your exam. So my question to you today is, how confident are you in passing your exam? Really look at that and determine that. Because just think, if you're not confident and you're beating yourself up and questioning and doubting if you will pass your exam, who is likely to pass their exam when they go to the exam? Someone who's full of doubt, or someone who has confidence, and confidence that can really overdo that anxiety that's going on, that can really rule it out for you. So I'll talk to you guys soon. Take care of yourself. As always, make this lifetime great, and you have the right to achieve your goals.